I'm Mark Rose. I'm an orthopedic surgeon specializing in sports medicine and general orthopedics. So I did my medical school at Ohio University, finished with the third and fourth year in Cuyahoga Falls. Most of my rotations were at Western Reserve Hospital, and that's where I stayed on to do my residency. After that, we moved to Richmond, Virginia, and I did a fellowship with a private group there for a year, and then came back and joined OrthoUnited in 2020. It was always my plan to try to make it back. I grew up here in Stark County in North Canton, so a lot of family, a lot of friends still in town. I was familiar with the group, and I wanted to come back and join the practice that I was familiar with, and had kind of grown up being familiar with and understanding how it works and what kind of care we provide to the community here. So I think we do a really good job trying to stay up to date with all the most recent techniques and technology that's available to help reach a good diagnosis and create a treatment plan. So whether that's advanced imaging or pre-surgical planning softwares, even the robotic assistance that we use in surgery for total joint replacement and even in spine surgery sometimes. I think that's helpful because it gives the surgeons another just check and reinforcement that what you're planning for the patient is going to be successful. Yeah, I think the first step is just being honest that there's a problem and that it's keeping you from doing something that you want to do or causing constant pain that's bothering you. I think the first step is just making that decision to come in and be seen, and that doesn't necessarily mean that you're going to have a surgery if you step through the door. There's other options. There's medication options, there's injections, there's therapy. Even just a discussion about modifying activities to limit symptoms can make a big difference for someone that's dealing with something. And that might change a lot for them, and they may not have to consider a surgery if the conservative options are successful first. If your condition does require surgery, we have the benefit of our ambulatory surgery centers, which we love working at. We believe that we can provide excellent care there efficiently. The feedback that we receive is excellent as far as getting scheduled timely, having the procedure done, and not wasting time that sometimes happens in the hospital setting. Yeah, so at OrthoUnited we encompass all facets of orthopedic care, from diagnostic imaging with our MRI. We can offer therapy to treat conditions that might not need surgery. We can offer preoperative and postoperative care in the office and surgical care at our surgery centers, postoperative physical therapy. Everything's kind of under one, it is all under one roof, and so the documentation is in one system and it's easy to follow patients along and see how they're doing. We can have updates regarding the therapy course after a surgery that reassure us that things are going well in between post-operative visits. Yeah, so I think that what feels best about treating someone surgically or even non-surgically is when they get to the point where they can go back to doing the things that they had trouble with and what caused them to come in the first place. So when they are able to go back to playing golf, or when they're able to go back to their physical, heavy manual labor job, and they're not having the pain or the dysfunction that they had before, that feels good because it's a success at that point. I think it's just like any field in medicine, as we do more, there's more good quality research out there that helps us to identify factors, during a surgery or before surgery to limit complications after and improve outcomes following the surgery. So the implants are getting better, they're lasting longer, but the diagnostics are also getting better. And so if we have a better image study before a surgery, we know exactly what to look for and how to plan for that during the surgery. And I think all that goes together. We're also understanding that there's ways to change rehab protocols to get people moving faster after surgery so that you don't deal with stiffness of a joint or weakness that comes on with immobilization for long periods of time. So I think all that goes together, and we can kind of improve outcomes by just continuously progressing with all facets of care. At OrthoUnited, we're committed to improving outcomes for our patients through continued use of advancements in orthopedic technology, diagnostics, and surgical care.